it is profuse. If it in 15 days, it can extend for a long time. And in the first day, the bleeding will be less. And the second day, there will be colic. Then there will be vomiting, hemorrhage with large clots, and every alternate period is so much more painful that the patient tells you that I have a track of my periods, but I also have a track of when it was painful and how it was painful. So all those complaints of uterine fibroids which have bleeding from the second day onwards and not from the first day should be your ground for prescribing thlaspi bursa pastoris. Sometimes in your practice, patient will come to you with reports and there is incessant bleeding and there will not be any control over the bleeding whatsoever medicine they have taken. And for you to examine what symptoms you need to prescribe for thlaspi bursa pastoris, for Trillium pendulum, for Ustilago, for Sabina, for Senecio aureus, there is too much data which is common and fitting all the remedies. So in that case, you can go back in the history of the patient and ask her how were the menses in your 30s, 35s, 40s. And if you see commonly mentioned scenario where the patient tells you that the first day there used to be no bleeding, the second day there used to be violent colic, then hemorrhage, and then large clots, that is the ground for prescribing thlaspi bursa pastoris. Next you have is hemorrhage or delaying menses from uterine inertia, exhausting, scarcely recovers from one period before another begins. So this is a situation where the uterus is hypertrophied, there is lot of content which is gushing out all the time, and as soon as the previous menses ends, like a day or two before, the next bleeding again begins. That is where you should think of prescribing thlaspi bursa pastoris. Leukorrhea, bloody, dark, offensive some days before and after menses. For comparison, Dr. Allen has mentioned thlaspi can be compared with synapis, Trillium, viburnum and Ustilago. We have already discussed Ustilago very nicely. It is almost like 10 pages in Allen's keynotes, but we need not remember all the 10 pages. There are some important essential points which we covered yesterday. You can go back to the recording and find out what is interesting. So we finish thlaspi bursa pastoris, an integral remedy for your prescription of fibroids. Next, next we'll cover the similar remedy which is Trillium pendulum. Now, what is the difference between thlaspi bursa pastoris and Trillium is that in Trillium pendulum, the hemorrhage is copious, like thlaspi of course, but it is also very active and also passive. The patient will be discomforted with the urine, the patient will also not be discomforted sometimes. And, and the hemorrhage in thlaspi bursa pastoris was dark red, clotted. Here you have bright red, and it can happen especially with a concomitant presence of similar bleeding from the other parts of the body, which is vicarious in nature, or it can be just a bleeding like epistaxis or uh, like a different symptom present elsewhere. This is almost similar scenario with ipecac and milefolium. Next you have is tendency to putrescence of fluids, flooding with fainting. So all those cases which have excess of bleeding, too much bleeding, profuse bleeding, and also a lot of vertigo accompanied with the bleeding should give you enough justification to prescribe Trillium pendulum. Again, In the epistaxis, nasal symptom, you will have it as a concomitant. There will be profuse, passive, bright red bleeding and bleeding from cavity after extraction of tooth. Hemamelis and creosote are other two remedies. In respiratory system, you will again have for Trillium hemoptysis, incipient phthisis, tubercular pathology which is bordering towards bleeding, or there will be bursting of the bacilli and bloody sputa with advanced stage of copious purulent expectoration and troublesome cough. Very rarely you will come across for prescribing Trillium in cases of chest complaints, but it will always come with the associated hemorrhage in the uterus or other parts of the body and fainting which will be accompanied. Sensation as if the hips of and small of the back were falling to pieces, as if the sacroiliac synchondrosis were falling apart. This is also similar to Sabina. And the patient of Trillium pendulum tells that she wears something which is very tight and constricting so that the pubic bones don't fall apart, as if the bones of pelvis were broken. The other remedy being Aeschylus. So all cases of hemorrhoids who have a lot of back pain and constipation, you should give a thought for Aeschylus. All the cases of hemorrhage, fibroids, sensation as if back is tight or falling to pieces, or it will, it is giving a lame sort of pain, bruised or something which is not holding together, you should think of Trillium pendulum. Another remedy is also Sabina. We will discuss in the upcoming sessions. For female reproductive system, Trillium pendulum has menses similar to thlaspi bursa every 2 weeks, lasting a week or longer, and after overexertion it immediately brings on the flow. Similar remedies, calcarea phos. Menorrhagia, the flow is profuse, gushing, bright red, at least movement. This is the scenario with Sabina. I guess we will take Sabina in the upcoming session on Saturday, because tomorrow and day after tomorrow we have the fever workshop, which is an interesting session going on. Next you have is menorrhagia in Trillium pendulum from displaced uterus at climacteric every 2 weeks, dark and clotted. So how will you find this symptom? Patient will come to you with report, and there will be kind of a position of the uterus which is misaligned with normal how it should be, and there will be flow of excess blood which is not regulated. That should be your prescription for Trillium pendulum. And in such a case there can be chances that it will not be bright red but it will be dark and clotted, like thlaspi bursa, pastoris and oscillago. At every climacteric, the flow is every 2 weeks and with faintness, vertigo, dim sight, palpitation, obstruction, noise in the ears, like the remedy Formica rufa. Interesting remedy coming up now. And painful sinking at the pit of stomach. So all these complaints will be detailed by the patient in different parts of the body. You will find it cumulatively mentioned in Allen's keynotes and other books where the associated symptoms are mentioned, concomitants are mentioned with the primary complaint. Trillium pendulum is a remedy which is complementary to calcarea phos in menstrual and hemorrhagic affections. So what you should do with these two remedies, thlaspi bursa and Trillium pendulum? In cases of fibroids, you should keep this remedy on a regular basis to drain the organ, to soothe the organ of the swellings, and continue the constitutional remedy every 15 days or every month. You will also need to give antimiasmatic every month or every 15 days, and it can be also associated with some other tincture which is going to help the patient. Otherwise, if only you are giving constitutional, it is not going to help. It will take a lot of time to heal fibroids in a case. You can compare Trillium with remedies such as China. It will have a lot of weakness after menses. Belladonna, Calica, Millefolium, Lachesis, Sepia, Sulfur, Thlaspi, Bursa, Pastoris, and Mustilago. So, two important remedies: Thlaspi, Bursa, Pastoris, and Trillium pendulum. Dark, bright. Back pain in Trillium pendulum, whereas in thlaspi bursa pastoris there is no back pain. And in Trillium there will be faintness associated with the complaints, whereas in thlaspi bursa pastoris there is just a passive flow of blood which is not discomforting. But what is interesting in thlaspi bursa pastoris, first day there is no menses, second and third day there is violent colic and lot of bleeding. So that's what finishes two interesting remedies today. And if this is helping you, please mention in the comments, and we'll continue this till the entire LN's keynotes are done with our study streak, and then we'll take up the next book, which will be mentioned on the feeds.